Autism spectrum disorder, also known as AU, is a disability where symptoms fall on a continuum from relatively mild to severe.
Because the symptoms of AU are so wide-ranging and vary from social communication impairment to repetitive or restricted behavior, it can be considered an umbrella term.
The Centers for Disease Control and Prevention, also known as CDC, increases estimate of autism prevalence by 15% increase in prevalence nationally. 1 in 59 children had a diagnosis of autism spectrum disorder, also known as ASD, by age of 8. ASD is about 5 times more common among boys than girls.
In many cases, there is strong evidence that genetics, neurological factors, and environmental contributions interact and result in autism. Some authorities now think that AU is better conceived as a disorder of neural networks because there are deficits in many areas of the brain rather than just one. Many individuals with autism exhibit neuronal underconnectivity, and this affects the cell's ability to communicate to one another. So no single autism gene exists, but there is scientific evidence for autism having a hereditary component. For example, when a child is diagnosed with autism, the chances are 15% that his younger sibling will be diagnosed with autism as well. This is 25 to 75 times more higher than the population as a whole. When an identical twin has autism, the chances that the other twin will also have autism are much greater than in the case of fraternal twins.
Diagnosis is made by a psychiatrist using criteria established by the American Psychiatric Association, DSM-5, also known as APA. Clinicians can complete behavioral analysis checklists by behavioral observation instruments and they can ask parents or teachers to fill out behavior checklists. Authorities are encouraging earlier screening times for children. It is recommended that pediatricians be on the lookout for signs of autism. Autistic regression occurs when infants progressively show symptoms of autism. 1 out of 3 children with autism experience this. They are not born with autism, but rather show signs of normal development and gradually show signs of autism until identified around 14 months. The identification of early behavioral indicators can help families obtain appropriate diagnostic referrals and access early intervention services, even before a definitive diagnosis is made. Researchers say educational programming should consist of direct instruction of skills, instruction in natural settings, and behavior management when needed. Direct instruction of skills requires a highly structured, direct approach. Applied behavior analysis, also known as ABA, is a highly structured approach that focuses on functional skills and continuous assessment of progress. Instruction in a natural setting for children with autism spectrum disorder consists of being in environments that children without disabilities would enjoy. Researchers are constantly trying to improve instruction in the natural setting, where normal language and social skills are naturally learned. Students with autism spectrum disorder often display highly inappropriate behavior, such as biting, hitting, or screaming. Authorities recommend a combination of functional behavioral assessment, also known as FBA, and positive behavioral intervention and support, also known as PBIS. This balance will allow the behavior to be addressed and dealt with appropriately, while also not looking past their positive behavior.
The 2 critical areas of assessment for children with autism are progress in language development and social and adaptive behavior. For many students on the spectrum, language acquisition can significantly affect long-term life outcomes. Ongoing progress monitoring of language development is important because it can help the teacher or speech pathologist determine if intervention is meeting the needs of the student. The assessment of expressive language, particularly for younger children with autism, includes measures from many different sources, including natural language samples, parent reports, and direct assessment through standardized measures. Comprehensive interventions for students with autism spectrum disorder include a focus on social and adaptive behavior. The Social Responsiveness Scale, SRS, is a parent-teacher scale that may be used to monitor their progress. Another scale, called the Child Autism Rating Scale, 2nd edition, CARS 2, is used for screening and diagnostic purposes. CARS focuses on behaviors that deviate from the normal development in children over 2 years old. The Autism Social Skills Profile, ASSP, is a standardized measure that examines social skills of children and adolescents with AU. It is completed by teachers or parents and includes 3 subskills: social reciprocity, social participation or avoidance, and detrimental social behaviors.
Autism spectrum disorder is one of the most common developmental disabilities. It is the result of a neurological disorder, and the functioning of the brain is affected. Autism is not a mental illness and is not caused by bad parenting. Autism is a combination of several developmental challenges such as these areas: communication, social interaction, sensory impairment, play, and behaviors. Every person with autism is an individual, and like all individuals, they have a unique personality and combination of characteristics. Productive programming, consistency, and strategies at home and at school will go hand in hand with effective communication. Evidence shows that early intervention results in dramatically positive outcomes for young children with autism, which all share an emphasis on early, appropriate, and intensive educational interventions for young children. Because of the spectrum nature of autism and the many behavioral combinations which can occur, no one approach is effective in evaluating symptoms of autism in all cases. Various types of therapies are available, such as, and not limited to, applied behavioral analysis, auditory integration training, PECS, which stands for Picture Exchange Communication Systems, physical therapy, sensory integration, speech/language therapies, and lastly, communication and social skills training. Cultural and linguistic considerations can contribute to challenges in identifying a child with ASD. Key steps involved for early intervention include early intervention services and tools such as screening tools and questionnaires. Second is the capitalization on children's tendency to respond to visual structure, routines, and schedule predictability. Third is the coordinated transition between service providers, including early intervention and transitions from different school grades. Fourth is the family involvement component involved family trainings and willingness to incorporate home training methods from involved professionals. Fifth, and finally, is the deficit areas such as social interactions, inappropriate play with toys, and others such as language comprehension and use in functional communication.
Autism impacts our field in multiple ways, including identification of autism,
knowing how to treat the individual's specific needs, and lastly, providing the proper tools effectively to go about daily living and communication in the classroom.